Well, the country is still ingesting that announcement as health teams conducting contact tracing to determine the origin of the first COVID-19 case here in the Bahamas. In studio with us this morning is Deputy Chief Medical Officer Dr. Delon Brennen. Dr. Brennen, welcome back to the Morning Edition.
Thank you.
Now, just in terms of the woman who tested positive a few days back with COVID-19, tell us where is the supportive care, where we are with the supportive care for her.
Sure. So we are in the midst of making sure that we support her health as a whole. So much like with other respiratory virus issues that you don't necessarily have a direct therapy for. So you don't have like an antibiotic or an antiviral that particularly targets that virus. What you have to do is make sure that the patient stays hydrated. You give them supportive therapy such as oxygen if they need it, if they start to drop their blood level of oxygen to go along with it. And if any other complications develop, that you address those as well. Because what you really want to do is make sure that you keep her body healthy enough to be able to fight off the virus itself. So much like when we have a cold and you just take something for your fever, but you're not taking anything specifically to address the virus, your body just fights it off. The same thing happens with COVID-19 as it does with influenza. Your body kind of has to do all the work, and you have to make sure that your body is healthy enough to do so. So that's what we're doing for her right now, and we'll continue to do for others who present with similar symptoms.
What about the people who she may have come in contact with? Do we have those numbers yet? And what is being done in this case?
Sure. The issue is going to be getting a total number of people is going to be impossible. There's no way to do that because as you travel, as you might imagine, when you go from day to day, you go to a store, you come into a contact with a number of people. You go to church, you get in contact with people. You go to a family event or you go to any sort of event, church or whatever. Then what happens is you end up getting in contact with a lot of people. You shake hands, you hug, that sort of thing. But there are also people who've sat near you in a waiting room, in the vestibule. And what you find out is there's lots of people that you'll never know that you were within 6 feet of. And so what we're doing is we can find out who close contacts are, family members, close friends, even, what church you go to and do that, the tracing around that. But you'll never find out the sum total of who all, the person may have come into contact with. So it's really making sure that, yes, we address those issues. We get in contact with as many of them as possible, find out if they have symptoms, but also get them to isolate themselves. But in addition, the public health side of things is going to be the much bigger issue. We need to make sure that the public understands that there are people going around right now that not only have this particular issue, who have influenza, who have other respiratory issues, and the only way to really avoid that is to do this social distancing, is to really have people avoid close contacts with people, staying with it, outside of 3 to 6 feet, making sure if you're sick, you stay home. If other people are sick, encourage them to stay home. It's really going to take a real population size effort to get this to happen. Otherwise, we're going to get a really large spike really quickly of people who are infected with the illness.
Now, I know you said that it's going to be difficult in terms of the sum total, but how many people have health officials actually contacted so far? Can we say that?
We're well over 50, probably closer to around 50 of the close contacts that we are starting to really get a handle on who she may have come into contact with for this individual case. But again, it's really going to take a much larger effort for the population to work with us, because just focusing on the one patient isn't going to get us the type of healthcare approach to stopping this that is really required. If you see what happens in countries that do it poorly, is they really focus on just the one case. Well, we know that one case is important, but it isn't the sum total of what you need to do. Countries who do it well really start with larger size activities and really then hone in on what needs to happen. So they start, with the schools, with workplaces, with large gatherings. Ceasing all of those activities is what is really going to stop the passage, throughout the entire community.
Now, outside of the Bahamas this past weekend, it was reported that a baby was born, the youngest victim of COVID-19 born with the virus passed from the mother. So now it's been confirmed that it can also be transferred like this. What should expectant mothers be doing? Should they be upping their game, so to speak, in terms of prevention measures?
Yes, and we think the same things we're telling other people, but they have to have a heightened sense because they're protecting not just themselves, but they have to protect their babies. So the good hand washing, avoiding large crowds, making sure that if other people are sick, they are, doing their cough etiquette. Something that we keep telling people to do when it comes to either pregnancy or young babies is making sure that people have their requisite vaccine. So if someone's going to come visit, this happened in our household. If someone was going to come visit, if you haven't had your flu shot, you can't come over. Right? If you aren't willing to wash your hands and use a cover-up when you're holding the baby, those sort of things, then you just aren't able to interact, because during this time, babies, older people, pregnant people tend to be those who suffer more when it comes to respiratory illnesses and the like being passed on from one person to the other. So you have to be vigilant in making sure that other people are not going to pass things on to you.
Now, a lot of emphasis is being placed on washing your hands, and a lot of people are relying really on hand sanitizers. What's the good, bad, and ugly about using these hand sanitizers, though, as opposed to thorough washing?
Right. Obviously, we advocate much more highly for soap and water because, that's tried and true. It works. It's not running out. You can find soap almost everywhere. Hand sanitizers, on the other hand, the issues around hand sanitizers are that when you really want to use them is when you haven't come into contact with bodily secretions. So whether that's, oral secretions, nasal secretions, blood, other sort of bodily fluids, the time when you use soap and water is when you come into contact with bodily fluids. Hand sanitizers work best when you may have come into dry contact or touching surfaces, but you can sort of, address that issue quickly as a convenience. But, as healthcare providers, when we come into contact with bodily fluids, soap and water is advised. And so people get comfortable with the fact if they use a hand sanitizer, they think they're fully protected. But the issue is, if you sneeze into your hand or cough into your hand or come into contact with someone else's bodily secretions, that's actually a time where healthcare providers advise that you use good old soap and water. Use it for a minimum of 20 to 30 seconds at a time in order to really rid your hands of any fluids that may have come onto them.
Now, the symptoms are the same, but what's the fundamental difference between a cold, a flu, and this here virus?
The issues around a common cold is that for the most part, most people will do very well with a common cold. You get a little bit of runny nose, you get some cough to go along with it. It is still very transmissible, but people don't do poorly with it. When you think about COVID and you think about influenza, the issues are very similar. And unfortunately, people can get really ill with either one of them. So we know that when you get fever, you get cough, you get respiratory distress, and people can end up needing hospitalization, needing oxygen therapy. They may actually need intensive care therapy as well. That can happen with both of these. And unfortunately, around the world, we're still seeing thousands, if not millions, of influenza cases. And every year, we see about 500,000 deaths worldwide due to influenza. And so far this year, we've seen in excess of 100,000 deaths already due to influenza. With COVID-19, it's brand new. There's no vaccine for it like there is for influenza. So we understand there's going to be a lot of worry and panic related to it, but that's mostly because it's new. And there's no preventative measures. And so it's going around the world and we're really worried about it. And it has the ability to affect people. And you're seeing, a significant number, let's call it about 5% of people who will have a death due to it. But you still have 95% of people who do very well or do well with it, or who will recover from it. So, we have to kind of put it in context. I consider the issues around influenza as serious as I do around COVID-19. People really need to take the flu seriously. And the fact that we have a vaccine against it means that people really need to take it seriously because you can prevent yourself from getting it.
Well, thanks so much. That was Dr. Delon Brennen with us this morning. Crucial information he's sharing with us on the COVID-19. Straight ahead in the morning edition, private and public schools closed as new measures to tackle the COVID-19 set in.